Hello everyone! This is Dr. Juana Miranda and welcome back to my YouTube channel, Dr. Vlogger. Yes, I already completed my 2 doses of Sinovac vaccines. Now that I completed my 2 COVID-19 vaccines, so what now? That is a very common question, especially those A1 to A3 in mga population that have completed their 2 doses of the vaccines. So let me just flex our Paranaque VIP Vaccine Information Passbook. My first vaccine, of course, it was Sinovac, was March 9 and my second one was April 6. So it's been almost a month since my second dose of vaccines. And if you're going to ask me, did I have antibody titer or antibody test to check my antibodies? No, I didn't check it, but some of my colleagues did, and most of them have elevated antibody titers. So now the question is it recommended? Is antibody titer test recommended post-vaccination, especially after your second dose? No. It is not recommended by the US CDC, by the WHO. It is not recommended because as of now, we really don't have a standard antibody test for COVID-19 antibodies, especially post-vaccination. Whatever results from those tests are, it's not very reliable to say na these antibodies that have been detected are not guaranteed that they are those antibodies that are protective. Mayroon ba silang neutralizing immunity or capability? And also the timing of the tests also matter. And there will also be tendency na magiging negative yung test mo, but it doesn't mean na wala ka ng antibodies or you will not develop antibodies. I have a friend that tested or that got tested with, it was her choice, she's a doctor. She had a COVID-19 antibody titer and negative yung result. But like what I said, sometimes the timing of the test matters. So, hindi mo din masabi na wala na siyang antibody or she will not develop any. The proof of the clinical efficacy of these vaccines, as always, should be based on the clinical trials. Yung results nun. So, if you really want to check the efficacy of these vaccines, be updated with the clinical trials. So yes, it is not recommended, but I am not totally against it as well. You can check your antibodies if you want to. There are a lot of laboratories and even hospitals that offer antibody tests. But as a doctor, I'm not recommending it and I'm not even advising it to patients that have been vaccinated. And yun na nga, marami lang akong mga colleagues that have tested. And in fairness, may mga results that are, matataas yung titers nila. And also, one issue about getting vaccinated, especially after completion of your second dose, is the intervals. And the intervals of the vaccination. So there are some who are concerned with the delay of the vaccination. They were concerned na baka they have to start all over again. But that's really no big deal. May mga catch-up immunizations naman po. However, I think what matters is the timing or the giving of the vaccines early. Kumbaga kasi yung Sinovac, it was found out, diba, that when you give it like 2 weeks interval, naging 50% lang efficacy niya. But if 4 weeks siya, umaakyat siya to 70%. And even the Astra, umaakyat din nung naging 12 weeks interval siya compared to the 4-week interval. So, the interval matters more in a sense na getting the vaccine too early is not advisable. That is one concern of other patients, of other people, especially those that are asking. Another concern about getting vaccinated after daw is the vaccine passports. Are you even required vaccine passports? For now, what I know is wala naman ganon. Wala pang ganon. However, I heard that the US is already accepting travelers with emergency use listing na ng mga vaccines. As as of this moment, there are like 4 vaccines that are under EUL, yung Pfizer, Moderna, J&J, Astra. Yung ibang vaccines are already in progress, in the process of getting that EUL. So, for now, wala pang mga vaccine passports na sinasabi. Parang yun naman din talaga yung magiging future natin na especially if the travelers are from COVID-19 cases na matataas na countries just like our country. So I think somehow it will be a requirement. So yeah, people get vaccinated. One issue as well are the major side effects of blood clots, especially with the Astra vaccines and blood clots. Of course, it's possible, but 1 in 10 million of the population lang po. So, hindi naman po siya talaga common. Compared naman the risk of dying from COVID-19 na ang ratio is 1 out of 10. So, dun na lang po tayo sa magpababakuna tayo kasi most likely hindi ka naman po magkakaroon ng blood clots. Story time lang, in our experience in the hospital, to be honest, we had patients that developed deep vein thrombosis or pulmonary embolism, but those conditions kasi, they're very manageable and we know how to manage those cases. Some patients that have been vaccinated with Astra, meron kaming ganong case na nakapag 1 dose na siya ng Astra, COVID confirmed siya. Fortunately, hindi naging severe yung COVID niya. Nagka-complicate with deep vein thrombosis, and that is one effect of the Astra sinasabi nga, di ba? But we cannot conclude na it's really because of the Astra vaccine because the patient has been admitted for more or less 1 month na din sa hospital, and there are a lot of causes of deep vein thrombosis, of pulmonary embolism. So, hindi mo siya masasabi na dahil sa vaccine yon. However, her COVID is not severe. So, that was a one good effect na ngayon, she is about to be discharged. Nakapag 1 dose lang siya ng Astra nun, ha? Perhaps it can happen, but the thing is, mas more tayo maging concerned muna dun sa COVID kasi 1 out of 10 has a risk of dying from COVID-19 compared to 1 out of 10 million with blood clots. So, even if I am vaccinated with already completed 2 doses of my vaccines, I still act as if I am not vaccinated. I still follow basic safety protocols, mask, face shield, wear level 4 PPE in COVID ward, COVID ICU, social distancing, avoid crowds. We'll never know. Someday, one day, when everyone else is vaccinated, we can act as if we are vaccinated. One by one, pwedeng hindi na din mag-mask, pwedeng mag-mask na lang, hindi na mag-face shield, we'll never know. But for now, even if you are vaccinated, still follow the basic safety protocols. Anyway, if you like this video, please share this video and subscribe to my channel. Click on that notification bell to be updated with my latest uploads, and shout out to all my friends, the doctors, nurses that are still serving the COVID or in this pandemic. Also to the nurses, Happy International Nurses Week. See you in my next video, and bye-bye.